I'd like to call to order this meeting of the Peabody City Council Finance Committee. Present for the committee this evening are Councilors Gamache, Gould, Manning, Martin, Turco, and myself, Councilor McGinn, as chair. Also present this evening are Councilors Peach, Daigle, O'Neill, Melville, and Rossignol. We have two items on the agenda tonight. First item, Ordinance Amendments, Section 18-20, Schedule of Compensation for Part-Time Positions, Section 18-21, Rates of Compensation for Full-Time Positions Not Subject to Collective Bargaining, Section 18-20A, Schedule of All Positions Not Subject to Collective Bargaining, Section 18-43, Fringe Benefits for Municipal Employees of the City of Peabody, excluding fire, police, electrical, and school personnel. Mr. Mayor.
Thank you, Mr. Chairman. Good evening to you. Good evening, councilors. Hope everybody's doing well. I'm here today to request an ordinance amendment to sections 18-20, 18-21, and 18-43. We are very fortunate to have an outstanding collection of hardworking and committed people who work for our city, each providing an important contribution to our government operations. Approximately 85 of these workers, many who are here this evening, are ordinance employees. The large majority of our city employees are members of one of the 15 city unions whose contracts are negotiated through collective bargaining. We have reached agreements with nearly all of these unions, and as I typically do, I wanted to now bring forward to you, our ordinance employees, for a much-deserved cost of living adjustment. You have all heard my position on this before, so my strong support for this increase comes as no surprise. But tonight I wanted to focus on three words: retention, attraction, competition. The key phrase I'm going to stress tonight is that we need to be competitive and meet inflation to attract quality candidates and retain the hardworking, dedicated, and talented people who already work for the City of Peabody. The work culture across our country has changed dramatically since COVID, and we all know that. And it certainly has affected Peabody. Last calendar year, we had over 70 non-teacher retirements just on the city side, and many more resignations. This exodus is unprecedented in recent city history. This culture change created immense workforce challenges in cities and towns across Massachusetts and across our country. Several departments have been short-staffed, as it is much more difficult finding qualified candidates to fill open vacancies, putting more pressure than ever on our employees. And when government operations are not working smoothly, our residents get understandably frustrated, and all of us as elected officials hear it. Statistically, the number one factor in employee satisfaction is fair compensation. Simply put, we need to be competitive to retain our employees. Without question, municipalities are in competition with one another, and I know many of our employees have been approached by other cities and towns. Some cities, like Salem, are even offering signing bonuses. I know a few of our city employees have received higher offers from our neighboring communities to leave Peabody for higher pay. We subscribe to the Mass Municipal Association website, and this is a monthly newsletter that goes out and that lists a whole number of things, but quite a few of the pages are devoted to job opportunities and employment opportunities. Right now, the last time I looked, there were over 300 job opportunities for a number of key important positions, ordinance positions. Many of them are here today. Just to give you one example, our finance director in a western city of the western part of the state that's a little bit smaller than Peabody, just put out a finance director position for $165,000. So I want to be very clear. Competition among cities and towns is very real. Retention must be prioritized. The reasons I believe this are many. There is significant institutional knowledge in our ordinance employee group that we have here tonight. Many in this group are retirement eligible today, and we hope to incentivize them to stay employed here full-time. The cost of turnover is significant. Losing institutional knowledge can set cities back. Finding qualified candidates has become extremely challenging, and overcoming the learning curve is time-consuming and puts extreme pressure on all other employees within those individual departments. A real concern is that if any one of our ordinance employees were to resign or retire and we were unable to fill the position internally, which I always like to do. But if we can't, I anticipate that I will have to come back to the council for a larger increase than 3% prior to posting and filling that position. City government is its people, and we are very fortunate to have the people in this room working for our city. They care about their jobs and take pride in their work. They want Peabody to be successful. The vast majority live here in Peabody. Most grew up here, raised or are raising their family here, and nearly all have family that live in our city. And we need our employees to continue to choose to work for Peabody. We have been working hard over the past few months to have consistency within our salaries and to properly compensate our employees by looking at job responsibilities and management responsibilities. There are 3 positions I'm asking for approval to increase salaries and move them to their proper salary tier. Sharon Cameron, our Health and Human Services Director, has taken on additional responsibility, and hopefully soon there'll be a division of social services that we're going to be introducing shortly, and we wanted to move her up to the appropriate tier. Frank Ian, our IT Director, has taken on more responsibilities in city departments, and we wanted to move him to the appropriate tier that he should be under. As well as Brian Grant. Brian is our Park and Recreation Supervisor. We wanted to put him in line with our cemetery supervisor, our golf course supervisor, to make it more consistent, and we felt that that was appropriate. I think all of you know their individual work, and I'm happy to answer any questions on this specific request. Also, as part of tonight's request is to add 5 positions to our ordinance. The first 3 is under the Division of Social Services that we're looking to move forward with. That would be part of our Health Department and Human Services under the direction of Sharon Cameron. It's funded through a combination of opioid settlement funds and the Healthy Peabody Collaborative, and approximately $30,000 contribution from the city. I think all of you are familiar with the opioid settlement. We now, for the last couple of years, have been receiving money through a collective agreement, nationwide agreement. We were one of the early ones to actually sign on to this opioid settlement. We all know the devastation and effect that it has had on our communities. Many individual families, people that we care about, certainly have struggled. And we signed on to this class action lawsuit. Settlement has been reached with a number of defendants, and now we are going to be receiving settlement amounts, or settlement funds, for the next 15 years. We expect additional settlements to come with additional defendants in the future, so I think that number will rise. So we'd be taking those funds that can be used for a limited number of purposes to create this division of social services. Also, as part of that, it would also include the Healthy Peabody Collaborative, which receives funding through state and federal grant. Those would be consolidated into one division, and it would be under the direction of Sharon Cameron. There are, and you recall at the last meeting, you transferred money that was in our account, set that into a specific account directed for these settlement proceeds. So that was done at the last meeting. These 3 positions I'm seeking approval for the division is a director of the Division of Social and Substance Abuse Services. That will be Sarah Grinnell. Sarah has been kind of the architect behind this whole proposal. We've had a number of meetings over the last few months. Councilor Turco has been at a couple of those weighing in. And it's been Sharon Cameron, Chief Griffin, Sarah, Beth O'Donnell, Mike Gingras, a couple of other people have been working on this proposal now for a few months. But Sarah has been the real architect behind it. It's been working for our city for a number of years, and we'd be looking to her to take over the director of this particular division. Also, a mental health abuse clinician, which we would advertise the position. And third would be a care coordinator, behavioral health and substance abuse, another position that we would be posting to bring someone in. Sandy Drover, I know all of you are familiar with her great work that she's done for the city. She would remain doing the work as the youth outreach coordinator, but she would be a part of this department. So this would be a division of 4 people. Sarah, in her new role as director, Sandy remains as the youth outreach coordinator, then we'd have these 2 additional positions. We really believe that this would fit a need. It's, I believe, unprecedented that a city has taken this step to create this division. I know a number of cities and towns, really all cities and towns, are trying to come up with their plans as to the best way to utilize this money. And again, it can be used from a few different areas, but we believe this is the way to reach families, to reach individuals in need, and to help them get the services that they need and demand. And we believe this is the way to go. So I'm excited about this going forward. The other couple of positions, 2 positions, would be specific to the North Shore Children's Museum. Allie Haydock is here to be able to answer any specific questions. The 2 positions we'd be looking to add would be Museum Community Engagement Manager and Museum Visitor Experience Program Manager. We believe that those 2 positions would allow us to expand hours, do some initial work, and then bring in some significant money by bringing on those positions full-time. We believe this would be a direct correlation to bringing money into the city and to continue to support that. Things have gone very well, as all of you know, at the Children's Museum. We've been sold out for weeks. We're looking to see how things go this summer. It will be an interesting test case, how things go for the summer. But we're really happy and pleased. And the demand is there. We want to meet that demand, and that's why we're moving forward with these 2 additional positions to add some hours and add some different programs. So really excited about that. Mr. Chairman, if it's okay, I wanted to ask Sharon Cameron, Sarah Grinnell, and Chief Griffin to come up to speak about the Division of Social Services. And also, Allie Haydock is certainly available to answer any questions. Mike Gingras, our Finance Director, is here. Beth O'Donnell, our Human Resources Director, certainly ready and willing and happy to answer any questions on any of these topics. But if it's okay, I thought this would be a good opportunity now to have Sarah, Chief Griffin, and Sharon to come up. Okay.
Yep. Please proceed with that presentation.
Sure.
Mr. Chairman, motion to receive the handout.
Councilor, you heard the motion. All in favor? Any opposed to vote? I'm going to give me a minute to distribute these.
Full screen. First, let's do this. Get rid of this. Put this here. No, because she has a different one. There you go.
How do I get to the next slide?
There.
Hit that. Okay. Good evening, everybody. Tom Griffin, I'm the Chief of Police. I'm going to present first regarding the Division of Social Services. In its basic form, this division is a classic community policing, problem-solving type of a strategy that we're going to employ. We're going to hopefully put together a team of people to help address and reduce the mental health and substance abuse by members of our community. Prior to the pandemic, there was always a need for mental health and substance abuse, but since that time, the needs have increased exponentially. And as you can see on the PowerPoint slide up there, just last year in 2022, we responded to 923 calls that had behavioral health concerns, just at the police department alone. 84 overdoses were recorded. We believe that's a low number for us because with the availability of Narcan, we're being told by folks that we talk to that not everybody contacts the police when there's an overdose episode, so we believe that number is higher. Any clinician or substance abuse counselor that we get involved with this will be working on those types of problems to reduce those numbers here in the city. We actually think, working with our partners with the Essex County Collaborative, as you'll see in the handout, they're going to inform us on people who are Peabody residents who actually have an overdose issue anywhere in the county, which will improve our ability to bring services to those folks. And in addition to both the police department and the health department, pretty much every department within the city at one point or another is touched by either mental health or different types of substance abuse, whether it's through trying to find food for folks or housing or different other stresses that are creating problems for them. So hopefully by applying this type of strategy, those numbers will go down and the overall health and wellness of our community will improve. In addition to just the statistics and just my own anecdotal experiences at the police department, you can see with this next slide, the Leahy Hospital did a needs assessment for 2022 as it related to Peabody, and over 40% of the folks in Peabody have reported to them that their substance use has increased since the pandemic. So since the pandemic has really caused a lot of problems for a lot of people, put a lot of stress on a lot of people, and it's starting to manifest itself out in the community with repeated mental health issues and repeated substance abuse issues. Inpatient discharge rates for mental health conditions for people under 18 are actually significantly higher for Peabody than the average of the state. We're at 1,034 versus 772 in 2019. And emergency room discharge rates for substance abuse disorders among those under 18 were higher also across the state. So, as well as chronic conditions for elders that we hope to be able to address with some of these issues by having this team in place that's going to approach these problems, help solve those problems, get these folks to the right places that they need to be so that we don't have to have them experiencing bad days again in the future. So with that, I'll turn it over to Sharon.
My name is Sharon Cameron. I'm the Director of Health and Human Services, and I want to thank you all for your time tonight. We're going to be discussing in a few moments funding for this project in detail, but I thought it was important to start off by recognizing that a significant portion of the funding for this project comes from the Attorney General settlement with the opioid manufacturers, distributors, and retailers. This funding comes to us through the pain and the loss experienced by thousands of people and families throughout our state and in our community. As our working group continues to plan for the most effective use of these funds, we start with recognizing our obligation to those who have suffered by committing to ensuring that help is available to those who need it and by strengthening our efforts to prevent substance misuse. So the mission statement for this new division would be for us to support the well-being of all Peabody residents by identifying their needs, providing resource referrals and crisis stabilization, and by coordinating access to physical, mental, and behavioral health care services. The Division of Social Services also coordinates substance use prevention programs within the city, including opioid use prevention and opioid use harm reduction programs and treatment programs, as well as primary prevention programs that foster positive youth development. The mayor mentioned that Sarah Grinnell has been identified to be the director of this division, and you all know Sarah as the director of the Healthy Peabody Collaborative. Her position will be restructured under this proposal. Sarah has over 18 years of experience managing substance use prevention programs, but her knowledge of the community and the connections with so many of our local agencies and service providers that she has built over the past 15 years that she has been in the city of Peabody makes her an outstanding choice to lead this proposed new division of social services. As Sarah leads you through the structure, roles, and budget in the slides ahead, I also wanted to let you know that this proposal aligns very closely with the terms defined by the state of Massachusetts for allowable activities for the opiate settlement funds. Our focus will be on supporting individuals in treatment and recovery, connecting people with behavioral health care, implementing harm reduction programs, and expanding our substance use prevention programs. So I'm going to turn it over to Sarah to talk to you in more detail about our structure. Whoops. Actually, I'm going to talk to you about the structure first. So you can see the division sits within the health department, and over on the left side, the youth outreach coordinator, Sandy Drover, would be the Healthy Peabody Collaborative activities would be encompassed in this new structure. But the new positions that would be proposed for this division include the substance use disorder behavioral health care coordinator, and a licensed clinical social worker, as advised by the Social Services Commission, all under the directorship of Sarah.
All right, good evening, everyone. I'm going to go into a little bit more detail about the structure of the division and talk a little more about the specifics. I met with many of you last fall, and we talked about the work that the Healthy Peabody Collaborative has done with Sandy and I in the community over the last 15 years, and we talked about the continuum of care, and that we've really focused our efforts on prevention. The health department, the Healthy Peabody Collaborative, the fire department, the police department, and community partners have worked across the continuum. They've worked through identification and intervention, access to treatment, and recovery supports. However, we haven't been able to do so in a cohesive and strategic manner. We haven't had the funding and we haven't had the structure. Under this new division, we would be able to be more cohesive and more strategic because we have this funding and we have the structure now. We're not looking to replicate any of the services offered in our city and our surrounding towns. What we're looking to do is to connect our residents with those services and to support them through the process. Anybody that has had a family member that struggled with mental health or substance use issues knows how difficult it is to navigate that process and to see it through. We want to provide that support to our residents, and we want to use the funding that caused the damage to our community to do so. The last piece I want to discuss from this slide is we will be establishing a social services commission. The mayor will be appointing representatives from the police, fire, health, school departments, council on aging, and city council. We'll have broader membership that will include the recreation and library departments, healthcare providers, social service agencies, community members, and those with substance use disorder lived experience. The commission will advise, support, and monitor the division's strategic plan, assist with developing the division's long-term goals, and assist with the promotion of services. On the next slide, you will see a breakdown of the settlement funds that will be received over the next 17 years. The damage that has been done to our community through these distributors and manufacturers have been done over a long period of time, and I believe that the money was structured in this way to help stabilize our community and to help support the residents. The $2.7 million that we'll be currently receiving through fiscal year 39 will go directly back to our residents that are either suffering with substance use disorders, struggling with mental health issues, or the family members that are having their own struggles or trying to support their family. This is a long-term plan. Sharon mentioned, and I believe the mayor mentioned as well, that we think this is the start. We anticipate that there will be additional settlements. There are also monies that went directly to the state that will be then distributed to the cities and towns once the state develops their strategic plan, and will be eligible to apply for those sources of funding as well. The next 3 slides, I'm going to provide an overview of the budget for fiscal years 24, 25, and 26. You'll see in fiscal year 24, we'll be using a little under $200,000 of the opioid settlement funds to support the division. You can see the next column over is our DPH grant. That is our substance abuse prevention funding. As I mentioned last fall, our funding was initially for $125,000 over 8 years. However, it's been doubled for fiscal years 23, 24, and 25, so we're receiving $250,000, and there is potential for that to increase past fiscal year 25. This budget is based off of for fiscal year 24. And then the next column over, you will see the Essex County Outreach Grant. That's a regional partnership. It's based out of the city of Newburyport, and the chief mentioned that they've created a database so we're able to better serve the residents of Peabody that either suffer a mental health issue or an overdose in a different community. We're able to better support our residents through that grant. We've been meeting with them, and they have committed that if we're we establish this division and we bring on a social worker, that there's some room for some collaboration there. We'll be able to receive the $25,000 for fiscal year '24, and there's potential for that to continue through fiscal year '27. The last column indicates the city funds. $7,500 was originally allocated for Interface, which is a referral to treatment program that the city's been utilizing. The social worker and the care coordinator will be resuming the role that Interface previously played, so that $7,500 will go towards supporting their salaries. The other $25,000 actually comes from the indirect funds from our substance abuse prevention grant through BSAS, and those monies will be used to serve the direct care. You can see, I would say most importantly in this budget is that we have $10,000 that's going to be allocated in fiscal year '24 for scholarships. The scholarships will be for Peabody residents that are accessing recovery services. It'll be to help support them for the uninsured costs of accessing treatment. For me, that's the initial goal of this division, is to get that program up and running and to help support our residents. It is our primary goal. Lastly, I just want to say that on the personnel, you'll see in the next slide that we're only funding partial year salaries, knowing that we wouldn't be able to hire as of July 1st. That is the increase that you see in the fiscal year '25 budget here. So we're using some additional opioid settlement funds. Our DPH grant will again be at the $250,000, and then the Essex County Outreach, we have at $0 because that was only a one-year agreement. As I previously mentioned, there is a chance that that will continue into fiscal years '25 and '26. I also want to mention that you'll see in a later slide that we're going to be doing a lot of evaluation to make sure that we're meeting the needs of our residents. And the scholarship program will be assessed, and that number, likely may need to increase. And as more of our residents are finding out about that scholarship program, we'll be using the opioid settlement funds to support the residents. The ask in fiscal year '26 of the city is higher. That is assuming that our BSAS funding goes back down to the initial contract level of $125,000, and it is for the flat funding of the AG opioid settlement funds through fiscal year '39, which would be $160,000. I don't want to make any promises I can't keep. However, we do anticipate there'll be more settlements, and that would decrease the ask of the city. I think the other piece that's really hard to convey sometimes, just looking at the numbers in black and white, is through the creation of this division, we're going to be open to applying for more funding in different resources that we haven't been able to do so in the past. And we're going to be able to prove the need in a way that we haven't been able to. And we're going to be able to assess the need in the way that we haven't been able to figure how we can best serve our residents. Here's the program evaluation slide. We'll be assessing and tracking the number and demographics of individuals served, the types of referrals that are made. This one's really important to me in particular because this is how we'll be able to better inform our strategic plan moving forward. We'll know what our city needs and what our residents need, the number of direct clinical hours provided, the length of time until initial service delivery. That's a big one because right now it's difficult to access services, and we want to break down those barriers for our residents. The length of time until connection to follow-up care, the number of primary prevention events and participants reached, the number of harm reduction events and participants reached, and lastly, the number of scholarship applications received and scholarships awarded. And the budgeted amount will be adjusted based off of the findings. Here's my ambitious timeline. I like to say that, really bringing on the social worker and the substance, the care coordinator will really make a difference in the lives of many of our residents. And I would say my first two goals are 1A and 1B. 1A being to bring those two people on board, and 1B to begin awarding those scholarships. You'll see here that we have the scholarships, being launched at an event in January. However, I would anticipate by the end of the summer, we'll have a process of accepting applications that's very simple for residents and awarding that money out. That'll be the first charge of the Social Services Commission. I want to thank everybody. The counselors have been a huge support of Sandy and I's and for our prevention efforts over the last 15 years. People don't typically stay in these roles that long. We're very grateful to be part of this city. This has been a goal of both of ours. I know it's Sharon and the mayors and the chiefs as well, is to support our residents. Peabody is an amazing city, and I just want to thank you for your support. And I think the use of these funds to give it directly back to our community is the best use possible. Thank you.
Thank you, Mr. Chairman. Thank you, Council. Happy to answer any questions on any of these items, all these items. Allie Haydock, the director of the North Shore Children's Museum, is here as well to certainly answer any questions and more specific information you may need regarding her plans for the 2 additional full-time employees. So, Mr. Chairman, I'll turn it over to you for the next steps.
Thank you, Mr. Mayor. Questions from the committee? Councilor Turco.
Thank you, Mr. Chairman. Temporarily, I'm just going to stick with the opioid positions, and I just want to say, I mean, you've all heard my story. You know how this has directly affected my family. But I mean, this is something that we've been looking at since the late '80s, early '90s, since the advent of OxyContin, and every year, every so often, we talk about how we're going to try to solve the opioid problem, but something else takes precedent, whether it be a financial crisis or whether it be a pandemic, and maybe rightfully so. But I mean, ultimately, I think it's the money's here. As Sarah, maybe Sharon stated, a lot of people paid dearly to get this money. So I think, although it's not completely able to fund, and there is a portion of city money that needs to go into this, I think it's minimal, and I'm very confident that Sharon and Sarah will both continue to seek out grants. I think, going back to the opioid epidemic, I think the primary problem was we got the OxyContin off the market, and we never addressed the issue with those that were already addicted to OxyContin. So, again, with relative to my family, my sister, 2 brothers, both addicted to OxyContin, got off it, but became addicted to heroin instead. And that was because OxyContin wasn't available. And, good people, all my siblings, very good people, you would have loved them if you met them, did a lot of wrong things. Robbed, started at home, robbed from this, people around the city. You see it every day in the police reports. You see, home breaks. You see people rummaging through cars. You see assault batteries. You see robberies on the street. Those are generally addicts looking for money. I can't say all, but most good people addicted to something that they just don't know how else to get the money. So I know that, we're going to look at money. We're going to look at, as we should, what the ultimate cost to the city is financially. But I think there's just so much more than the dollar bill that we could look at by even saving 1, 2, 5. I think the chief mentions, 85 overdoses. All 3 of my siblings overdoses. Save one if you can.
Thank you, Councilor Turco. Other members of the committee? Councilor Manning Martin.
Thank you, Mr. Chairman. Through you to Sarah, when will the city absorb the cost of these new positions and their pensions? When will we begin to absorb the cost?
So in fiscal year 39, that would be the last year of the settlement funds currently. So the total cost of the positions would be absorbed at the city at that point. So we're looking at 17 years from now. Prior to that, in fiscal year 26, there is an increased cost to the city. And that's due to us evening out the distribution of the opioid settlement funds for the subsequent 15 years. And also, our substance abuse prevention funding goes back to the original contract level of $125,000.
Thank you. And your positions now are all grant, the current ones are grant, Healthy Peabody Collaborative are grant funded, is that correct?
Yes.
So your current salaries now, you are not paying into the pension system, correct?
No, we are paying into the pension system, yes.
Under the grant? Okay, that was one of those, okay, that's right. Okay. And so how many positions are there currently in the Healthy Peabody Collaborative that are already paying into the pension system?
There are two.
2, so you'll be adding 3 more.
2 more.
2 more.
My position would be changing, my title would be changing.
Your title will be changing, but in this document, I see your title, your old title is still there. Is that correct?
I do not believe so, no.
Let's just check.
It is? Okay. Oh, okay. I believe it's not funded, though. I'm sorry, I didn't know which document you were looking at. I believe it's not currently funded. The money was shifted, correct? Yes.
Okay, so there are 2 already in the pension system, and this will add 2 more. And the reason I ask is, it's a very sensitive subject. You know, I've been an advocate and a cheerleader for your program since its inception. And I don't want to get into the benefits or anything other than what can the taxpayers afford. And the reason I bring this up is just because just quite recently, I don't know, it was 2 weeks ago or a month ago, the pension board voted against a one-time 2% COLA, cost of living increase for existing pensioners. And I think it was $300 a year, just one time. And they voted against it because our pension system was in such dire straits. So I will always, from this point forward, be very hard-pressed to add any new positions to the budget until we get a handle on moving forward, being able to pay cost of living increases for pensioners. And we can't do that if we continue to add positions and give salary increases 3% across the board to people who make 6 figures. And I sound like a broken record at this point. This isn't the first year I've said it. It's not the second. Who knows? Maybe it will be the last. But I've certainly said it easily half a dozen times. So, again, I'm really hard-pressed to add any new positions to this budget because of what we were just faced with within the last few weeks. And it's fresh in my mind, and I don't want to forget it. So, again, your program is wonderful, and everything Councilor Turco says is true. But that's where I'm coming from. And I thank you again for everything you've done and the 15 years you've given the city, and your team has been phenomenal. And I hope in some manner you'll be able to continue to do it. Thank you.
Thank you, Councilor Manning Martin. Other members of the committee? Other councilors? Councilor Peach.
Thank you, Mr. Chairman. Through you to Sarah. Can't go anywhere yet. Sarah, I've had the pleasure of knowing you for a long time and getting to know the work that you've done for the city of Peabody. Can you just speak to a little bit, maybe not everyone's aware of how the Healthy Peabody Collaborative started through grants, grants which have run out multiple times, and you're an excellent grant writer. You've been very successful in funding your program through grants. without costing the city any money. And I appreciate you being forthcoming and saying this is the reality, but, you know, of course, I know you'd continue to work on grants. This is helpful to know. This is a possibility for us as a city to take on costs, but if you could talk a little bit about that so people at home know.
Of course. So our initial funding was actually, Sharon Cameron wrote the grant back in 2008, and that was for substance abuse prevention. It was primarily an enforcement grant. That was for $80,000. And since that time, we have increased our budget up to, you know, upwards of $300,000 through both state, federal grant funding. We've diversified our funding. I don't think Sandy and I have ever said no to anyone who has asked us to do anything. We've done this through summer food service program. We've done this through law enforcement grants. We've been able to, at one point I monetized all of our volunteer hours. I think that's a piece that's not reflected in here, is the support of our community, our city employees, our counselors, our elected officials. Everybody has supported us. But yes, no, our grant funding has continued. We have been, you know, held up on a national level for success. I've been able to pivot a little bit into the law enforcement grant writing field and have been pretty successful, I'd say, right, doing that, which was not my area of expertise at all, but I feel like grant writing is grant writing, so I really do. I don't like to promise things, but you know, I have a list on my computer, and there's at least 10 funding sources on there that we would be eligible to apply for, that we just haven't had the capacity to do so. So yes, there is a cost to the city, but if we don't move forward, there's also a loss to the city that I think is important to acknowledge.
Thank you. I really appreciate you just outlining that and making it known that you've run a successful program through applying and being very creative as to what grants you can apply for and use funding to continue the program and expand it significantly since the start many years ago. So I appreciate that. I think this is an excellent add to the city. I understand Councilor Manning's reservations. I share them for other positions to be added. But I think this is an area we know nationally grant funding will just continue to increase. And we, as Councilor Turco put it, we do need to do something. So thank you.
Thank you, Councilor Peach. Other councilors? Councilor Turco.
Mr. Chairman, just looking for clarification on your format here. Are we just speaking about opioid, this program itself right now, or are we delving into the entire document, or do you want to finish this section and move forward?
Yeah, so what's before us, Councilor Turco? Thank you for that question. It's because it is a little confusing. We have 3 separate ordinance changes requested. The multiple things that the mayor mentioned in his presentation encompassed everything in the first ordinance change, that inclusive of the opioid, or I should say the creation of the new department. So what's before us is the request to change the Section 1820 in its entirety. So we're not able to dissect out a portion of it related to what was just presented. We need to address the overall request to change this ordinance. So that includes the salary changes and the changes that the mayor indicated relative to the salary adjustments for the director of IT and so forth. Does that help?
Yeah, thank you. I just didn't want to move on from the subject if anybody else had any questions about this particular program, but I am willing to continue on with the rest of the document. But let me just say, lastly, with regard to this program, we're handing this to Sharon Cameron and Sarah, and my confidence level is there that they will find the remainder of the funding, and that in 2026 we will look at this and say that it's funded through outside grants in the opioid epidemic. I'm confident in that, the opioid settlement, excuse me. So I'm confident in that, but that's the last thing I'll say on that, and I do support those 3 positions. As far as the rest of the document, I do have some questions and concerns about that.
This is the right time to get those questions on the table, Counselor.
Thank you very much. Mr. Chairman, I'm going to, through you to Mr. Gingrich. I think most of my comments are going to go to Mr. Gingrich. Gingrich?
Ms. Chambers.
You all set, Mike? All right, I'm going to start at the very beginning, emergency management assistance. I believe there were 4 of those that we created maybe last year, or is that the one under it, or was it 3 plus the emergency management director that were created? Can you remind me of that? Might have been last year.
I believe we funded 3 plus the director.
Thank you. Can you remind me who we attributed those 3 positions, those 3? I look at them as stipends, which kind of...
Yeah, the stipends. We've only utilized the director, the fire chief, and the IT director as the assistant so far.
So the fire chief, the assistant IT director, and what was the third one?
That's it. We haven't filled it. We haven't utilized those funds for
Okay.
further.
Do we typically give raises to stipends?
We generally do just, whenever we have COLAs, we just take everything and bring it up so that, 5 or 10 years from now, it's not lagging behind.
Okay, and who was the current emergency management director?
Chief Daly?
And you may not know this, Mike, but I'll ask you, do we intend on keeping that with the fire chief upon Chief Daly's retirement?
Yes.
Thank you. All right, move on to the next page, Mike. The assistant farm stand manager, that's a salary correction up $7,000 inclusive of the 3% raise. So is that just raising the top end of the ordinance that we're looking at, or?
That was one of the positions that we were fitting into that particular tier. So it was similar responsibilities to the assistant director of the Children's Museum and the skating rink.
Okay, why does it say June of 23 next to it?
I utilized the date there just to denote that's something that's changed beyond the 3%.
All right, next one, parking clerk, police department, which is currently on the city website. I've actually had several people reach out to me to see if it's available. Why are we increasing the salary of an unfilled position by $10,000? $10,500 to be correct there.
Again, that was posted at a $60,000 range in order to attract someone for that position as part of this whole new parking program that we're going to implement. And it's something that's out in the market trying to get filled.
Are you saying, I can ask you, Mayor, are you saying that nobody was interested for that job at $50,000 a year? They'll only take 60?
Well, I did want to mention that we are starting, we had our introductory meeting with the meters, kiosks, lighting, and EV parking spots program that we're going to be starting this summer. We expect it to be completed in September. Part of that program will be new meters, kiosks to pay, an app that can be utilized, like other surrounding communities have, that will be able to make that process a much easier process for people, and certainly something that's been asked for by the businesses. During COVID, we shut down the parking meters. We really haven't taken in income over the last couple of years. We think that there's going to be significant income generated through this new program, and we felt that we needed to attract the right type of person for that position, because I think there's going to be, with the new programs, new technology, new systems that we're going to be implementing, we felt that that would be a position that should fall in that range.
Thank you. I mean, I'll just say up front, I disagree. I just think that, it's an entry-level position, and I know a lot of people would jump on that for 50,000, but I digress on that. The next one is the Enterprise Fund Manager, Mayor. Is that new? I don't ever recall seeing an Enterprise Fund Manager, and if so, who is that? Through you to Mr. Gingrich, Mr. Chairman.
There's no one currently in that position. That position was put into ordinance 10 or 15 years ago as a concept to have a person oversee the enterprises, and it was a concept at the time, and it was never brought forward. It's not funded.
Yeah, Councilor, it's not funded. That was something that predated my term as mayor, and it's not something that I've really ever looked at or delved into deeply, but it's been a part of the ordinance, and it's always been kept in there.
Okay, so you'd have no objection to removing it from the ordinance, or you do?
I mean, I'm certainly not going to object. I don't think it hurts us by having the ordinance in there. If it's not funded, it would have to be something that would be approved by the City Council during a budget. I'm not bringing that forward at this time. I don't envision doing that anytime soon. But I don't think it's something that hurts us by having it in there, and some point down the line, maybe it makes economic sense to do so. But certainly that's the will of the board. It's not something that is funded, not something I'm planning to bring forward.
Okay. The next one down the line, Superintendent of Parks and Forestry, which you mentioned was Brian Grant. I've always felt that, with Parks and Recreation and Forestry and under one umbrella, it's a lot for that department. It's a lot for one person to handle. So I do support a raise. I don't know if I quite support a $12,000 a year raise. I think that's pretty significant for anybody. I'll just, while I'm touching on the $12,000, I'll touch on Director of IT, an increase of $15,000, Director of Health Human Services of $17,000. These are one-year increases. So I have a general disagreement with any raises of that magnitude for any one individual. And I know what you're trying to do, Mayor, and Mr. Gingrich, I know you're trying to make them, as you said, equity counts. I just also believe in I mean, we're looking at a $309 tax increase on average in a week. And whatever I can do to curtail that, I'm going to do. So if it offends anybody here, I apologize. I have the utmost respect for anybody, for all the people in this room. I just don't see some of these raises are pretty drastic. Those three in particular, I should say. So I'll move on to Public Health Nurse Administrator, through you to Mr. Gingrich. That one's a decrease, and I'm confused by that. 2022, 96.6, and it goes down in 2023 to 94.6. So there's a $2,000 decrease in the salary.
Yeah, well, we were going through and evaluating different positions. That one in particular, we just determined it was better aligned in the other group, in the group that we reduced it to. It hadn't been filled yet, so at that point.
Okay, so this Public Health Nurse Administrator has not been filled for how long?
It hadn't been, and we were going through union negotiations to move a particular person into that position.
Okay, and again, I'm moving forward because I know this is in the budget next week, but did I read correctly, or do I remember correctly that you're adding 3 of those positions in the new budget, Mayor? Or the 3 clerks to the nurses? And this is separate from those 3 clerks. Okay. So this Public Health Nurse Administrator would oversee the 3 clerks? Is that the intention, or oversee all the nurses? How does this work?
Good evening, Beth O'Donnell, Director of Human Resources. Sharon can jump in if I say something incorrectly, but that is not the intention. The clerks, counselor work for the school nurses, and this position is the public health nurse in the health department.
Okay, so again, the three new positions are the clerks in the school department, but they're in our budget, correct?
Because they work for the school nurses that are in our budget in the schools.
Okay, yeah, that's all I was just looking for. Let me move on to, I'm sorry, Beth, that's all I had for you. I wish I had more. The minimum wage positions, Mike, I see that, we're leaving a lot at minimum wage.
Councilor Turco, point of order on that. That's a different section. So
Okay.
If we could, just to get everybody focused on the same document, if we could.
Yeah, so I'll stick to this, and I guess, we're always, respectfully, Mayor, I'm always going to disagree that I think that each of these positions in the ordinance should be separately vetted, and raises should be handed out as they are in most organizations on a per-person basis. I think that every department head here knows their staff and knows who deserves a 3 or a 4 or a 0 or a 1% raise and who doesn't. I particularly don't know that. I just know that, to Councilor Manning Martin's point, 2 weeks ago, we did hear from retirees that, and we did, or at least I did, I supported the position of the retirement board that they couldn't rightfully give an additional 2% raise. So I feel very uncomfortable with some of these salary levels. In a different format, I may support it. I would be more inclined to support this instead of a 3, 3, and 3 at a 2, 2, and 2. And I know nobody here wants to hear that, but you also, I don't think the taxpayers want to hear next week that I'm going to give them a $309 average increase, and I didn't do anything to try to curtail it a little bit. So the best I can do is to suggest to this subcommittee that we go with 2, 2, and 2 rather than the 3, 3, and 3. And others may have a different opinion on that. So with that, Mr. Chairman, I'll hand it back to you.
Thank you, Councilor Turco. Other committee members. Councilor Manning Martin.
Thank you, Mr. Chairman. Through you to Councilor Turco, I appreciate your effort to compromise, Councilor Turco. My concern is that 3% for somebody making $45,000, $50,000 is a lot of money to them. So to go down 1%, I wouldn't be able to support that. It's the idea of the inequities again, same thing that you and I have said for the last several years, is giving 3% to people who make 6 figures is a larger sum of money, and than it is to someone at 50,000. I don't want to reduce. I wouldn't want to reduce somebody at making 50,000 to get 2% instead of 3%. I don't think that compromise attacks and addresses the issue at hand, but I do appreciate your effort to try and come to a compromise. But I wouldn't be able to support that. I do have a question. Since we have identified a couple of positions that are not filled, I'd like to find out how many others that are listed before us in this document, looking for the ordinance change, are not filled. I know the business liaison is not filled. We learned that the enterprise fund manager is not filled. Mr. Gingras, do we have any others that are not filled?
I don't know that off the top of my head. I could go through the list and report back, but I'm sure there's a handful.
I'm sorry, you're sure there's a handful? Okay, I'd like to make a motion then to remove what we do know that has been in the budget for several years and not filled at this point is the enterprise fund manager. I'd like to make a motion to remove that from this ordinance language. So moved.
Councilman Manning Martin, on the motion, before we proceed with that, would it make more sense to do that when we vote the entire thing, just to strike that line item, or do you?
I'd prefer we just take care of it as it's before us right now.
Okay, you've heard the motion from Councilman Manning Martin. On the motion, seeing none, roll call.
Councilors Turco,
Yes.
Manning Martin,
Yes.
Gould,
Yes.
Gamache,
No.
McGinn.
Yes.
Motion carries 4-1.
Thank you, Mr. Chairman. May I continue?
You have the floor.
Thank you, sir. I'd like to make a motion to remove the position of business liaison from this document, asking for the ordinance change. So moved.
On the motion, you've heard the motion on the motion, Councilor Gould.
Thank you, Mr. Chairman. Through you to Mr. Gingras. Mike, that is currently stipend pay, is that correct?
Yes, it is.
And what is the stipend, please?
So that was a position that, we have discussed in multiple years. I was looking for opportunities to save money, and I spoke about this last year and the year before. I didn't want to go ahead, Councilman Manning Martin has talked about pensions and other fringe benefits, and I felt hiring that position would have been at a significant cost. Between benefits and everything would have been over $100,000. We give a stipend of $15,000, maybe $18,000 to Chris Ryder, who was already doing a lot of those responsibilities already and has done good work with that. I just felt that it wasn't necessary to hire that position, and it was an attempt to save funding.
Thank you, Mr. Mayor.
Again, it's not funded, just like the enterprise fund was not funded. It really has no effect on the budget that we're going to be taking on next week. I don't see any objection to it to remove them. It just doesn't hurt us to have it in there for the future, again, recognizing cities changing and there could be potential needs in the future. But again, those positions are not budgeted. They have no impact on the budget.
Mr. Mayor, through you, Mr. Chairman, I'm all set. Thank you.
Thank you, Councilor Gould. Yeah, on the motion, Mr. Gingras, would removing that have any impact on the stipend funding, or is it?
Yeah, I believe so, because part of the reason for the stipend is that particular slot.
So if the slot's not there, the stipend's not available. So it would basically negate our ability to fund it as it currently is funded.
Exactly.
Thank you. Nothing further. Yeah, Councilor Manning Martin.
Thank you. On that, so the business liaison position is not funded, but and it's not in the budget, but if we remove it, it's titled from the budget, monies will be taken from the budget that's not there. Did I get that right?
There's a stipend in the budget based on this position, part of the part-time wages in community development.
So there's an $18,400 stipend for Chris Ryder to do the business liaison work, and then there's more in community development that has been?
That's where that funding is. It's in community development.
That's where the $18,400. Okay, so that stipend, I think, we issued that last year. Has there been a pension justification received by the pension board for that $18,400?
Yes, I believe so. I believe that it's retirement eligible.
Yes, it is retirement eligible because the money is being taken out of his pay, but it requires a pension justification letter to be sent. That's what I'm asking. If a pension justification letter is not sent, then his money will not go towards the pension.
Oh, I believe that's happened, yes.
I'm sorry?
I believe that has happened.
So a pension justification has gone in. So last year, that position got a 3% raise and an 18 $18,400 raise on top of that. It wasn't a stipend. It was presented to us as a stipend. It was a stipend, but when it gets into the pension system and there's a pension justification, I believe, as it was explained to me by the pension manager when I inquired last year, that's $18,400, and then on top of the 3%, I think it was like a 25% raise. And if he's pension monies is coming out and he's gotten a pension justification, then that was a 25% salary increase. So these stipends are not just one-time bumps. They're going into pensions as soon as a pension justification letter goes in, just so everybody knows.
Mayor?
So my motion stands, and I'll move the question.
You're not going to allow me to respond to that?
No, I'm moving the question.
All right, so as mayor, I'm not going to be allowed to respond to that question. Okay, thank you.
Okay, the question's been moved. Roll call.
Councilors Turco,
Yes.
Manning Martin,
Yes?
Gould,
No.
Gamache,
No.
McGinn.
No.
Motion fails 3-2.
Councilor Manning Martin.
On the motion? That was a motion to move the question, right?
No, that was the motion. That was... Yep, that was the roll call on the motion. I verified with the clerk. We moved the question. And that was the preface that I put on it when it was taken. No, not voted. Councilor Manning Martin, you still have the floor.
So that vote through you to the city clerk, there was a motion to move the question. Was that vote not on the motion to move the question?
There is no roll call on a motion to move the question.
Thank you very much.
You're welcome.
I'd like a motion to reconsider my motion to remove the business liaison's position from the operating budget. I think I was confused on that. I think Councilor Turco was as well. Maybe others were, but I'm going to make a motion to reconsider removing that business liaison's position.
Councilors, you heard Councilor Manning Martin's motion for reconsideration on the motion. Seeing none, roll call.
To clarify, this is the roll call to decide whether to reconsider. It is not the reconsideration. Councilors Turco,
Yes.
Manning Martin,
Yes?
Gould,
Yes.
Gamache,
No.
McGinn.
No.
Motion carries to reconsider 3-2.
On the motion?
On the motion, Councilor Manning Martin.
I'd like to propose the motion again for a roll call. Thank you, Mr. Chairman.
Okay, so this is just for clarity for the committee. This is the original motion is under reconsideration, and that is a motion to remove the enterprise fund manager from the ordinance language. I'm sorry. Business liaison. Thank you for that correction.
Mr. Chairman, if I might, under Robert's Rules of Order, a person on the opposite side of what the motion, the hopeful motion to be made, cannot be made by somebody who voted on the minority side. It must be voted on in a motion made by a person on the majority side. Councilor Manning Martin, under Robert's Rules of Order, is not allowed to make that motion. It must be either Councilor Gould, Councilor Gamache, or yourself. It's an illegal vote, a motion that was brought illegally by the person.
Thank you, Mr. Mayor. I do have the authority to rule on points of order, and I'm going to let this vote proceed. So, roll call vote.
This is on the motion to remove the business liaison. Councilors Turco,
Yes.
Manning Martin,
Yes.
Gould,
No.
Gamache.
No.
McGinn.
No.
Motion fails, 3-2.
Councilor Manning Martin, you still have the floor.
That is all I have. Thank you very much, Mr. Chairman.
Thank you, Councilor Manning Martin. Other councilors? Councilor Melville.
Thank you very much, Mr. Chairman. Mike or Mr. Mayor or Beth, a lot of what you discussed was about retention and competition. Do you guys, is there a percentage of what you can see as somebody's benefits and salary cost based off of either a retirement or somebody leaving that position that would impact ultimately? I know you were talking about having to increase for increase the salary for attracting other folks to fill those positions in case somebody retired or moved on to another community. Is there any sort of metrics you have for that? I'll take it from either the Human Resources Director or the Mayor, or Mike.
Counselor, so I've been doing a lot of work with my colleagues in the MMA, and we regularly review salary surveys and work together to try to figure out how we're all together going to address this crisis in hiring. One of the things that's traditionally happened, and I can't say that it doesn't happen here, but we do work towards the goal of trying to recruit people from outside public service to bring them into public service, because in the current environment, it really doesn't assist any of us regionally to be continually stealing employees from other municipalities, because then it just puts the municipality next door in as bad a shape as we just left. So statistically, there's national literature suggesting that it costs about a year's salary to bring a new person in to an unfilled role. I think that's probably more so in the private sector, because in the public sector, as you know, what happens is we aren't usually able to stop doing all the things that we're doing, so the tasks just sort of get more spread out. So I think it's more of a toll on employees here. What we're seeing is that when positions aren't filled as quickly as we'd like them to be, because we don't have as many qualified applicants in some of those roles, the cost is monetary, and there is literature to that effect, but I think it's also a real toll on the employees. So that's the part that I can speak to, if that answers your question in part.
Yes, I mean, it's kind of going to what we're talking about tonight. You know, if you go down Route 1, you'll see the MBTA is offering $10,000, $7,500 signing bonuses. What you're seeing is a marketplace for hiring in which the public sector is competing, various public sector entities are competing against each other. I can tell you that NAGE, which is the state employee union, settled for 4% raises starting July 4th and then January 1st. So that's actually going to be a 8% in percentage, but it really adds up to more like 9%. So I would just put that out there, as that's, you know, who municipalities are competing against. They're not just competing against other municipalities, they're competing against the state. I've recruited people from municipalities with state benefits and state pay. There are certain skill sets that are in demand. I think one thing that, you know, I'm sure Mike can attest to, dealing with what he does, that the training in the software, I'm sure Councilor Daigle knew his when she in her previous position, but the software that municipal employees are using is very specific to their job, which makes them in more high demand. And you know, I'm more worried about the retention side, frankly. Early folks that retire, you know, that's something that, you know, if we get a group of retirements at one time, can have strain on the pension system that was discussed earlier. So I think all of those add up to, that's really somewhere where I see some some stress on the system. And I deal with every municipality in the Commonwealth, and it's everywhere. And I know, as the Human Resources Director pointed out, that the MMA is working strategically with communities to ensure that they're not picking off each other's folks, arbitrarily driving up salaries. And lastly, the point I would make is I know there's some other communities, some of the more, like the Cape Cod and the islands, they're actually offering, staff to work remotely in a hybrid model. So you're actually being able to recruit at a longer range. And if you go to the MMA website, you'll see Southern New Hampshire and Rhode Island municipalities are offering positions there. So this is a really unique situation. I think it's a unique marketplace right now. And some of what we discussed tonight, I think, is a way to address that. I do leave it up to the managers and the mayor and the Human Resources Director to put in place, their annual reviews. And a lot of what we're talking about tonight is the maximum for those ordinance positions. I know not everybody is at that maximum, but it gives you some leeway to use that for, to enhance people's performance or to reward good performance. So those are just my thoughts. This is a unique time. It's one of the rare times that the employee has the edge over the marketplace. And I think sometimes folks don't, it's not a common thing when you see hundreds of jobs available on the state website and in various municipalities throughout the Commonwealth. So I appreciate the time. I appreciate the information. Thank you very much.
Thank you, Councilor Melville. Any other councilors? Seeing none, what is the will of the committee? Councilor Gamache.
Yes, if I may, I would move approval on the ordinance amending Section 18-20 entitled Schedule of Compensation for Part-Time Positions, and Section 18-21 entitled Rates of Compensation for Full-Time Positions Not Subject to Collective Bargaining. Be it ordained by the City Council of the City of Peabody as follows. Section 1, the ordinance establishing a compensation and classification plan is hereby amended as follows. The Code of the City of Peabody, as adopted on January 23, 1969, and amended, is hereby further amended by deleting from Section 18-20 and 18-21 the ordinance establishing a compensation and classification plan and substituting therefore the following. Section A, Section 18-20 entitled Schedule of Compensation for Part-Time Positions is hereby amended by substitution of upper limit of annual compensation as follows for FY23 and through FY25. Do you want me to list all those or just as submitted?
As in accordance with the schedule submitted in the attachment to communication from His Honor the Mayor dated May 17th, 2023. And if you could continue on from Section B.
Section 18-21 entitled Schedule of Compensation for Full-Time Positions Not Subjected to Collective Bargaining is hereby amended by substitution of the upper limit of annual compensation as follows for FY 2023 through FY 2025, as further stated based upon the submission of this document dated, what was it, May 17th?
Correct.
It is submitted on May 17th. So moved. Do you want me to go through the next part too?
No, I just, if you need to make the exception of the enterprise fund manager in that schedule, because
with the exception of the enterprise fund manager, which was voted on to be done away with. So moved.
Yeah, and if you could just Section 2.
Section 2, all ordinances or parts of ordinances inconsistent herewith are hereby repealed. Section 3, this ordinance shall take effect as of the first pay date in July 2023. So moved.
Councilors, you heard the motion from Councilor Gamache. On the motion, seeing none, roll call.
Councilors Turco,
No.
Manning Martin,
No.
Gould,
Yes.
Gamache,
Yes.
McGinn.
Yes.
Motion carries 3-2.
Mr. Gingras.
Thank you, councilors. This next section addresses the part-time ordinance. We haven't been back since 2017, And during that time, the state has raised the minimum wage up to $15 an hour. What we're trying to do here is to create a floor and a ceiling so that whenever the minimum wage changes, that becomes the floor. We have a $15 range to add to different levels in order to attract people with different skill sets, people that have been here with us for a while, and or for positions that just the market requires a higher wage. So that's what you have before you.
Thank you, Mr. Gendris. Questions from the committee? Councilor Turco.
Again, I don't have issue with paying people minimum wage as we should. What I have issue with is I'm looking at, museum staff. We haven't even had these positions in the budget for a full year. But we're going minimum wage plus 3, when meanwhile we just went through a contract negotiation with paraprofessionals that we wound up at $18.65 an hour for somebody in year 6. Year 7. But you want to pay the museum people that just got hired 8 months ago $18 an hour. It just doesn't make sense to me. We're treating this as though this is CBA. These aren't collective bargaining agreements. We could talk about NAGE. We could talk about any other union you want to talk about. These are people that pay union dues, pay for representation, but we want to treat those that aren't the same. It's just, that's terrible. That. Museum staff, $18. Mayor, I realize you're probably offended. I'm offended too. So, $18.65, year 7.
You were not part of that negotiation. That is not an accurate
I certainly
statement.
was part of that
No,
negotiation.
you were not part of that negotiation.
I certainly was part of that negotiation.
That was not the terms of the deal. That was not the terms of the deal.
Okay. Well,
Councilor
let me tell you,
Turco,
I see the paycheck when it comes home every week.
Mr.
So I know
Mayor,
what she makes.
Councilor
She makes
Turco,
$18.65.
we're not going to
And you wanna
talk
pay
over
That is
each
not
other.
the terms of
Mr.
the deal.
Mayor,
That is
2-minute
inaccurate.
recess. 2-minute recess.
Please, but that's what's important. Let's play the museum people, but screw everybody else. Yeah, I represent everybody in this city. Please don't tell me otherwise.
Councilor Turco.
You want to throw it to everybody else,
2-minute
but
recess.
screw the CBAs. No, it's not happening.
We're in recess. Councilors, we're just waiting for PAT. Back in session. Councilor Turco, you have the floor.
Thank you, Mr. Chairman. First, let me just apologize to you and apologize to the mayor. It was an issue that was pretty important and personal to me. So with that being said, those are my concerns, is that I understand some of these positions that have been on there for a long period of time. And actually, I may even say that some of these positions deserve more than minimum wage. But my main issue is that we have new positions that were just added less than 8 months ago they're already higher than all of these other positions. So with that, I'll give it back to you, Mr. Chairman.
Thank you, Councilor Turco. Other committee, Councilor Manning Martin.
Thank you, Mr. Chairman. Regarding the Children's Museum, I know when it was first raised, there was a lot, I believe it got a lot of council support, but it was strongly encouraged by a majority of the council, if my memory serves me correctly, that it didn't belong in the budget and that we should be working towards it becoming a private nonprofit and get it out of our budget. And I'm wondering if I could ask the museum director, has there been any progress to that end? And do you have a business plan, moving in that direction? And how is it going?
Ms. Haydick.
Hi, councilors. This is Allie Haydick. I'm the director at the museum. Thank you for your time and your support you've had of the museum so far. So we're at about 8 months so far. We actually hit 20,000 tickets sold today. We've raised $360,000 this year. So we'll easily eclipse our budget of $380,000 that you gave us last year. So as far as the long-term plan, we've formed a board. We've had a couple meetings. We have a finance committee with a really strong group of folks on it who are working on a long-term forecast, taking into account what we're getting in kind through the city. So being part of the city, we get much more than the $380,000 or whatever is approved for the operating budget. We're getting IT support, HR, all of that. So we're working with Mike Gingras to calculate exactly what we would need to be our own nonprofit and stay open. We're looking at projections for next year with the addition of the 2 employees. And it's really not an addition, it's an increase from 2 part-time employees to full-time. I'm projecting will be well over $600,000 in revenue next year. So we're very actively looking at how we'll peel away from the city. It's going to take probably 3 to 5 years. We need to have a solid nest egg and a foundation in order to do that and ensure we can stay open. And I think growth at this stage is necessary in order for us to do that. So having the capacity to fundraise in my job means needing more support in other assets of the museum right now. We have 1 other full-time staff, and most museums our size have about 20 to 50 employees. We've filed to create the Friends of the North Shore Children's Museum, so we have the EIN number for that. We're working with Liz Lashway, the Assistant City Solicitor, to get that fully up and running, hoping by July we'll have that foundation set up, and that will run kind of parallel to how to the museum as a department, similar to how the Council on Aging runs the Friends, similar to how the library has the Friends, and that will allow us to fundraise even more and apply for more grants. But so far we've raised $108,000, really not having much time to do that.
Well, thank you for that update, and I hear nothing but rave reviews about everything involved at the Children's Museum, everything that you're doing there, the technical and computer skills, and everyone's raving about it. So it will be the success. So I think the vision, that work. I think cutting himself a little short is but there are so many progress days that are trying a bit to write big checks to children, and the mayor, right, there is one on the North Shore. He's right, it's an opportunity. But I think, and I know you have members that are counselors that are here this evening, I do think that you need to focus and expedite on getting a nonprofit status, because I believe it's not something that we should not have in the budget. Busy and successful. I also know there are people that have tens of millions, hundreds of millions of dollars that to projects like this, and they're just chomping at the bit. So we just have to prepare ourselves to see that. I encourage you, and also in the word of the Children's Museum, to really make that a priority to make that happen. So good luck with everything. Again, I'm hearing nothing but rave reviews, and thank you for your work.
Thank you.
Thank you, Council Manning Martin. Other committee members? Seeing none, Councilor Marsh.
Yes, at this time, I move approval, be it ordained the City Council of the City of Peabody as follows. 1, the section, excuse me, that section 18-28 entitled Schedule of Compensation of Opposition, not subject to collective bargaining of the classification and compensation plan of the City of Peabody, Massachusetts, be amended by inserting in place thereof. Hourly rated positions not subject to collective bargaining will have a minimum rate equal to the current Massachusetts minimum wage, with the option of adding up to 10 levels at 50 cents per level. Then another $1 from 10 more levels to the current minimum wage rate. The maximum amount that can be added to minimum wage is $15. And the positions are listed as on this dated May 17th. And Section 2, all ordinances or parts of ordinances inconsistent herewith are hereby repealed. Section 3, this ordinance shall be effective upon the passage and shall take effect as provided by law. So moved.
Councilors, you heard the motion from Councilor Gamache. On the motion, seeing none, roll call.
Councilors Turco,
Yes.
Manning Martin.
No.
Gould,
Yes.
Gamache.
Yes.
McGinn.
Yes.
Motion carries 4-1.
Mr. Gingras.
This next ordinance addresses the benefit portion of ordinance positions, and what we're trying to do here is to create some consistency between ordinance people and the people they work with in terms of longevity and some holidays and personal days. And in addition to that, we have a little bit of cleanup where we've gone to a Peabody Public Employee Committee agreement, and we're just putting that in to codify that as the document we're working from for health insurance and health and other related benefit plans.
Questions from the committee? Councilor Turco.
Thank you, Mr. Chairman. I did speak to Mr. Gingrich earlier today. You know, one thing that, and Clerk Danforth, one thing that, you know, through trying to find these documents online, none of these for some reason are listed in our city code, which, you know, 1843 is not listed anywhere. So I couldn't go back and actually look at what was previously covered and what, you know, the previous longevity pay was as opposed to now. So I guess my first question is, why is that not in city ordinance, Mike, either the pay scales, city ordinance. Why is none of that listed online?
As far as I know, a lot of these revert back to that 1969 coding sequences, and it's probably something that should be done to clean this up, maybe as part of the charter review and code amendments to move these into the current code.
Right, I agree, and you know, Councilor McGinn was nice enough to forward me an email that Councilor Manning had sent over a year ago, kind of notifying of the same thing, that she couldn't find this information online. And it's not even in our black books in the desks. So, just for us to reference back, I mean, obviously I could have gone back meeting by meeting and found this information. But it would be nicer just to have it there. I think it's public information anyway, so, if we could, through you, to Mr. Gingrich and the clerk, if we could find a way to add this to the Code of Ordinances, and I know, Allison, you need to be supplied that information to get it in there, I think. Forgive me if I'm wrong, but, Mike, if you could supply that to Allison for the future. I don't think we need that in the form of a motion. You know what, I'll make it in the form of a motion just to make sure it gets done. So moved.
Just to clarify, the motion is to get the salary ordinances incorporated to the, for online access, is that correct?
Correct, salary ordinances and fringe benefits.
Councilors, you heard the motion from Councilor Turco on the motion. Seeing none, roll call.
Councilors Turco,
Yes.
Manning Martin,
Yes?
Gould.
Yes.
Gamache.
Yes.
McGinn.
Yes.
Motion carries 5-0.
Thank you, Mr. Chairman. And the reason I reached out to Mike about this was because I don't know the cost of it, and I didn't know the cost of it. And, so we're deleting longevity, and we're adding, again, collectively bargained things that we want to give to ordinance employees, and so be it. Equality and fairness, I get. But we want to add longevity, holidays, personal days, funeral, and civic duty leave. So I didn't know what currently ordinance employees have and what additions this would be and what the long-term cost of the city. I think Mr. Gingrich gave me a rough estimate back of the napkin of about $40,000 a year. I just wanted to make that known to the rest of this committee that, and forgive me, Mike, I'll let you answer that questions that I asked you. Maybe you came up with better numbers since we spoke, but I think that was what you said, 40,000 per year.
I said depending on the gap, the change, but anywhere between 21 and 40,000 for the longevity piece, and I think in total maybe 60, with the extra day and everything.
Thank you. So that was just for edification of the council, that there is a cost to it. I do support the equality of it, and I will support it. Again, I just wanted to bring up the numbers for clarification. Thank you.
Thank you, Councilor Turco. Questions from other councilors? Seeing none. Councilor Gamache?
Yes, thank you, Mr. Chairman. An ordinance amending, I would move approval of an ordinance amending the ordinance to establish fringe benefits for municipal employees of the city of Peabody, excluding fire, police, electrical, and school personnel of the Code of the City of Peabody, Section 18-43. Be it ordained by the City Council of the City of Peabody as follows. Section 1, that the ordinance establishing fringe benefits for municipal employees of the City of Peabody, excluding fire, police, electrical, school personnel, and any other employees covered by collective bargaining, be amended as follows. A, by deleting the title of said ordinance and inserting in place thereof the following. An ordinance establishing fringe benefits for municipal employees not covered by collective bargaining of the City of Peabody. Section B, by deleting from subsection A of Section 4 entitled Longevity the amounts awarded for various periods for full-time continuous service and inserting in place thereof. Longevity, holidays, personal days, funeral, and civic duty leave shall be equal to benefits received by employees covered under the American Federation of State, County, and Municipal Employees, AFL-CIO, State Council number 93, local number 364. C, by deleting Section 13, medical insurance, and inserting the place thereof the following. Effective July 1st, 2019, the City of Peabody shall follow the Peabody Public Employee Committee, PPEC, agreement for contribution to employee health plans and related benefits. Section 2, all ordinance or parts of ordinances inconsistent herewith are hereby repealed. Section 3, this ordinance shall take effect upon passage of the ordinance provided by law. So moved.
Councilors, you heard the motion from Councilor Gamache on the motion. Seeing none, roll call.
Councilors Turco,
Yes.
Manning Martin,
Yes.
Gould,
Yes.
Gamache,
Yes.
McGinn.
Yes.
Motion carries 5-0.
Next item on the agenda, item B, transfer of fund, cable fund expense in an amount of $215,212.94. Mr. Gingras.
Thank you. This is the cable transfer for Comcast for the first quarter of 2023 to pay the fees over to Peabody Access Television for $215,212.94.
Questions from the committee or other councilors? Council Gould.
I'm ready to make a motion when you move forward on that, Mr. Chairman.
Yes, please, Council.
Thank you. I make a motion to transfer from Receipts Reserve Cable Fund, account number 270-0000-33017, in the amount of $215,212.94 to Cable Fund expense, account number 270-0000-53007, again in the amount of $215,212.94. So moved, Mr. Chairman.
Councilors hear the motion from Councilor Gould on the motion. Seeing none, roll call.
Councilors Turco,
Yes.
Manning Martin,
Yes.
Gould,
Yes.
Gamache, McGinn.
Yes.
Motion carries 5-0.
It's time I'll accept the
Motion
motion
to
to
adjourn.
adjourn. Councilors, we are adjourned.